Welcome to Between the Sheets, the non-judgmental podcast where we're going to cover various sexual health and wellness topics. I'm your host, Dr. Stephanie Zwanitzer. I'm a urology and sexual health nurse practitioner, and I love helping my patients and listeners discover and develop their most satisfying sexual experiences. Between the Sheets is here to normalize the conversations about sexual health and cover everything from basic anatomy to the most taboo topics and everything in between. Real talk, real pleasure, one episode at a time. So come on, let's get between the sheets. This episode is sponsored by Boston Scientific and its educational website on erectile dysfunction, edcure.com. One study estimated that more than 50% of men over the age of 40 have some degree of erectile dysfunction, which can be frustrating and confusing. Go to edcure.com to find information on erectile dysfunction and treatment options, including long-term treatment options offered by Boston Scientific. Boston Scientific does not endorse any statements or opinions expressed during this episode. Hey, welcome back to Between the Sheets. We have a new topic today, so I'm super excited. We're going to talk about people with physical disabilities, spinal cord injuries, whether you were born with it or acquired it in your life. And we have Dr. Marita Heck all the way from Australia with us today. And she is a nurse, a midwife, a sexual quality of life support clinical clinician and researcher. She's an author and a speaker. She is just a champion over here. So I am really excited to have her on. Welcome.
Thank you so much for inviting me to your podcast.
Yeah, absolutely. So I'm really excited about this. You know, in my world of urology, we certainly see patients with spinal cord injuries and things like that and help them urinate better, catheterize better, things like that. But I don't really get involved with their sexual health much. So I'm really excited to talk to you about this because obviously, in my world, everyone deserves to have sex and should have great sex. So, how do you kind of work with these people and help them have their best sex life?
So yeah, it's basically what many people underestimate, I would say, is basically we are working with people who had a normal sex life before the accident, and then the accident changes their life profoundly. You know, like you were saying, we have to look into continence care, bowel care. We have to look into all the stuff, you know, the skin integrity issues, anything, you know, that is really so changing their lives. And then sexuality is one part of it. And so basically we are working with somebody who had a sexual life before and then everything changes. And then it's almost like starting from zero. And there's a researcher who says it's like being a teenager again for people who sustain a spinal cord injury, because it's like rediscovering their sexual quality of life all over again. And often it's re-education as well, you know, from what a person knew before and what's then possible afterwards.
Yeah, I mean, it's got to be very challenging, obviously rewarding work because you're helping people live better lives. But I would imagine there's a lot of emotional and psychological care as well as helping them physically because I mean, I can't even imagine walking into work tomorrow, having an accident and not being able to walk home, let alone have regular bowel movements, urination, sex, everything. I cannot imagine. And so there's probably some of that to what you do as well, right?
Yeah, so basically the advantage of being a nurse in this area is basically, as you can imagine, bowel and continence is all related kind of
Yeah.
to sexuality. And so it's basically, we look at it from a holistic point of view, and you already mentioned it. So we work with psychologists, and it's a multidisciplinary team with OTs, physios, just to look into, you know, what is actually possible, what, you know, what kind of positions are possible. And it's basically is a very multidisciplinary, holistic approach to actually, for a person who sustained a spinal cord injury, to rediscover their sexual quality of life. What we unfortunately see in research, but also in the clinical space, and I would love to hear your opinion about that, is healthcare workers' bias towards somebody who has a spinal cord injury to say, you know, we get it often in the clinical space, but I hear it a lot in the research space as well. They get told to forget about it. It's not possible anymore. And if you think about, you know, the traditional having penetrative sex, there will be challenges, although the challenges can be overcome with support systems and assisted technologies. But, I see it more, people see it more as a medical model. It's more about procreation and is it actually possible to still have a child and how do we approach that? Like, your podcast, I've been following it. The pleasure part gets completely, taken out of this
Mhm.
discussion. It's taboo. Nobody talks about it. And it's very frustrating for somebody who actually, faces that, because from research, we know if we actually can address, or a person who sustained a spinal cord injury can address very early in their recovery process about sexual quality of life, their overall recovery will be much better
Mhm.
if, somebody actually tells them, oh yeah, by the way, don't forget about it.
Yeah.
And it's always something I get so angry about it because it's actually not true.
Yeah, absolutely. I mean, it's easy to focus on how are you peeing, cleaning yourself, and how are you having BMs. We need to do those, right? Those are daily tasks that everyone has to do to stay alive. We should give a shit about everyone having sex on a regular basis and having
Yeah.
pleasure and all of those things too. But it's almost like it takes a back burner in the hierarchy, right? And it shouldn't. I mean, we need to have pleasure in life, and whether that is traditional penetration or not doesn't matter. You still get to have your pleasure in life.
And that's also a thing, I often see, and, to the defense of the health professionals, because often there is a lack of understanding what is pleasure, what is sexual quality of
Mhm.
life anyway. And so, if you think about penetrative sexual intercourse, it gets a bit more difficult. But like I said before, there are solutions available. But, sometimes they don't even talk about these solutions. So it's more about, what we found out in our research, especially, is we need to educate people, healthcare professionals,
Mhm.
and also in the community. So I work a lot in the community as well, where we have support coordinators or, insurance companies where we basically educate them. Look, this is a part, it's a life domain. I mean,
Mhm.
sexual quality of life is actually a human right
Yes.
and, very basic human need. And so we need to educate people. Look, this is what's happening. And I always say, when I actually go into universities and I lecture about that topic, I always say to my students, when do you know you don't, you breathe? And
Mhm.
it's when you actually can't breathe anymore. And I've actually observed from my work that this is very similar to sexual quality of life. So
Mm.
it's so ingrained in our life that we usually only see that it's not working or not possible if there is a problem
Yeah.
or something is different than before. And this is basically where I think many people don't even realize, or it's not on their radar, that it's so important to actually talk
Mhm.
about this, especially in a situation like that.
Yeah, absolutely. And I think, from my perspective, because I deal with ED in all my guys, well, not all of them, but the vast majority of my guys have some level of ED. And so, for me, I'm very well versed in having conversations. And when the pills don't work, we do injections and we have prosthesis and we have all these
Sure.
things. So for me, that's a normal conversation. But for a lot of healthcare providers, it's not. And especially if you get out of, like I deal with private parts. That's my job. That's what I do. Not every form of medicine does. And so once you start getting into other areas of medicine, they're real uncomfortable with these conversations. And so I can only imagine the lack of care and empathy for these patients. Let's go through some of these options. So, for men with spinal cord injuries, if they have erectile dysfunction or difficulty maybe maintaining, reaching orgasm, whatever, because of where their injury was, what are some of the things that you talk to them about?
It's basically very similar what you basically do in a general erectile dysfunction support.
Hmm.
So we look into Viagra and Cialis and what every medication path.
Hmm.
However, what we've actually observed, and I actually have talked to my colleagues around the world, is that with males who have a spinal cord injury, often Viagra doesn't work and they get really bad blood pressure problems
Mhm.
because, as you know, it's actually pulmonary hypertension medication. So, meaning the blood pressure goes even more down, and people with a spinal cord injury, to explain that, have generally a lower blood pressure than
Mm.
a person without a spinal cord injury. And
Yeah.
so that actually is really, many people feel very uncomfortable to take it,
Mhm.
and it's not effective as well. And so I usually then also go with, injections, basically recommend injections. And funnily enough, most of my meds are like, I don't want to have an injection.
Yes.
And then I say, well, you kind of don't feel it. But they were like, nah. So it's quite funny. And then I have extremely good results with a medical grade penis pump.
Mm.
So it's not your average one you get in a sex shop. It's
Yeah.
a highly medical grade penis pump, which actually also has specific medical grade penis rings.
Mm.
And we have extreme well success with this. So I would say it doesn't work with all of them. And the manufacturer usually says 9 out of 10 people will have a satisfactory erection.
Mhm.
However, one person not. But from my personal experience, I would say 95% of my clients, I recommend it. They are very happy, and they are happy because it's not a medical solution. And also, like you said, the implants. So I haven't had so far a client who actually went with the implant, but I know about people who do. So
Yeah.
yeah, it's just the same. It's very similar to what you are actually
Okay.
supporting your male clients with.
Yeah.
Yeah.
And when you do the penis pump, do you bring them in and teach them how to use it so they're doing it correctly, or
Mhm.
do you have some videos that you use? How do you do that?
So I do have videos, but the videos are not specified for people with a spinal cord injury. And so you really have to take into consideration that they have a loss of sensation. So you really
Mhm.
need to educate them about, penis rings are not recommended to be on there more than 30 minutes. And I actually usually say after 25 minutes, please remove them,
Mhm.
because they wouldn't feel it as
Sure.
such. Then also after they use it, and after any sexual quality of life or intercourse or anything that's sexual, even, from positioning point of view, it is recommended for them to always have a really good skin check. And
Mm.
especially if they use, any assisted technologies to ensure everything's fine. And then basically they have my connection, they have my phone number, and then they can actually connect with me if variations arise.
Okay.
But usually, if you educate them thoroughly,
Yeah.
it's working really well for them. But it's really important, and I really want to bring that up because there are other health professionals who work in this space, and it's really important to look into this. That you know, skin health after using something like that is so important, and it's important to educate, and it is important to have action plan if variations arise. Another thing that comes up with people with a spinal cord injury is autonomic dysreflexia, which
Mhm.
is a blood pressure increase for people above the level of T. And it's really important to also talk to the clients about that it could be that in any sexual quality of life, there could be an autonomic dysreflexia, and actually education the client what to do. And I usually work together with a GP where we
Mhm.
look into, medications and support if something is actually, occurring to them, because often they know, okay, bladder problems or bowel problems or any skin problems or injury or temperature change can
Mhm.
actually cause an autonomic dysreflexia.
Yeah.
But because we are so taboo with sexual quality of life, this is usually not talked about. So
Yeah.
that's another, layer.
Yeah, it is. Absolutely. Yeah, I specifically asked about the penis pumps because I don't really teach my guys how to use them. I show them to them. You put it over, you get the good seal, but I don't bring them in and show them. But I was thinking there might be more complexities to that with a spinal cord injury
Mm.
patient where you really want to make sure that they're doing it correctly and they've got, the positioning and everything and just figuring out what position they have to be sitting or laying in to
Yeah.
get it to adhere correctly. Whereas my guys who are more mobile can kind of play with it and figure it out at home. I think trying to play with that and figure it out at home and not have good sensation or good mobility would be overwhelming and I'd pitch it in the trash. So I love that you do that for your guys and give them that teaching experience.
Yeah, thank you. It's also important what you were just saying about, positioning, because depending on the level of injury, I have actually clients who have actually limited hand dexterity.
Mm,
So we do actually have manufacturer I work with. It's really great. They do have a manual pump, which you
mhm,
can basically pump with the hands. And then you have one where you could actually just push a button. And
okay.
often my clients can do that, or, they can do it with with this part of their hand,
Mhm,
so they can we basically need to work around how can they actually physically
yeah.
go and do that. Whereas, I also educate then the partners, if they have one, to actually, incorporate the penis
Yeah.
pump, because it feels a bit medical,
It
right? Because
does,
it is
it
a medical
does. It
grade
feels
penis
very
pump.
yes. It's not sexy.
Exactly.
Yeah.
And so I basically, what I do on top of that is then educating how to actually incorporate actually that in sexual play, in sexual fun. And it's always really, an eye opener how, how we can actually incorporate toys.
Yeah.
And then I say, just see it as a normal sex toy
Yeah,
and into
absolutely.
sexual play.
Yeah, that's so great. That's so great. I happen to work with 2 surgeons that do penis implants, so I see them on a regular basis. In fact, I saw one today when I was at work, and so for me, it's very common to see them, we do them in our post-prostatectomy guys who just everything else isn't working. Maybe they have
Mm,
really bad diabetes or they've had an injury or something else that, goes along with that. I do we have one guy who lost he's not paralyzed, but he lost an arm and a leg in a
mhm.
military, event, and so teaching him how to use that was very interesting because he only has one arm to be able to do things, and his positioning is interesting because of only the one leg and stuff, so that was kinda cool to get to be the one that taught him, but they are really cool, they work really well, but you do have to have the dexterity to be able to do it, to pump it up and inflate it, or your partner would have
Yeah.
to, I suppose. But yeah, they do work really well. Obviously the skin well during the healing would be an important thing to keep an eye on and things like that.
Mm.
But yeah, if you ever have patients that are leaning that way, I definitely recommend it. They work very well.
It's really interesting because I always, we have an initial assessment and then we look into, because I work with what my client would like to explore. And
Mhm.
then I give them some, recommendations. And like I said, it's so similar to what you recommend. And by the time we come to the penis implants, my clients are like, and, I'm super open. There is no, bias or anything. So, look, this is
Yeah.
an option. This is how it works. So I educate them about it. They're like, no.
Yeah. Oh, I have plenty of guys that'll say that too. I have plenty of guys that say that when we just start talking about injections too. And then they get to the point where they're like, all right, well, nothing else is working. Let me just try it. And they're like, oh, wait, that really wasn't that bad. It really was just a really tiny needle. And I really got a great erection. I was like, yeah, man, I'm not going to lie to you.
It's so interesting, but I would love to hear your experience when it comes to women and support for women, because I feel there is even more bias,
Mhm.
women pleasure, and so much more taboo around that. Because for a woman with a spinal cord injury, and you might know that, if you use a stronger vibrator, they usually are able to actually
Mm,
have an orgasm. It feels a bit different, but not
yeah.
much. So what I get to from what's it called? My clients tell me that,
Yeah.
and then it's really interesting to look into that. It's seen as so much taboo, and also just to for the listeners and viewers, for women with a spinal cord injury above the level of T6 is the same. So if they actually orgasm, they can actually have autonomic
Mhm.
dysreflexia. So we need to monitor that as well. And to ensure, is it actually happening? Usually, we just remove the stimulant, and
Mhm.
that's okay. But, some women want to experience an orgasm. So then you work with it. Okay. And then the same, going back to the GP, looking into
Yeah.
medication solutions and stuff like that. So it comes back to the holistic support again,
Mhm.
because, this is always, I would always say it's always a holistic support. And we've actually identified that in our research studies as well. And we really strongly recommend, if somebody works with people who have a spinal cord injury, always have an all holistic approach to that as well.
Yeah, absolutely. And I do see that in my practice with women. And I see it from a standard of women were taught that sex is for the man's pleasure or to make babies, not for our own pleasure. And also when it comes to masturbation, that masturbation is a man
Correct.
thing, not a female thing. And I'm a huge proponent of play with yourself, touch yourself, let your partner please you, all the things, because we deserve our orgasms, we deserve our pleasure. And so I talk to my patients about that a lot. I have ladies in their 70s that I'm talking about buying their first vibrator because they haven't done that for
Yeah.
themselves yet, you know? And so huge proponent of that. But I think it goes back to like what you were
Exactly.
saying earlier. This is always my caveat on the podcast is pleasure. Pleasure is experienced in many different ways. Orgasm is one of those ways, but you can have pleasure by, you know, laying with your favorite silk blanket or taking a warm bath or eating your favorite piece of chocolate, having a cup of hot tea, touching yourself in different ways and with different textures or temperatures or whatever. And those can all lead to pleasure as well. And so, you know, really for me, when women are resisting me when I'm telling them to go play with themselves or let their partner play with them. Uh, you know, it's like, all right, well, let's take it back. Let's take the masturbation piece of it off the table and just enjoy your own company and find pleasure in some type of touching way. And then eventually work your way up to where that also includes an orgasm.
And it's funny that you're saying that because my oldest client I had, who actually got a vibrator for herself, was 85. So
I
it
love
was
it.
really,
I
that
love
was
it.
really cool. And you bring up a really important point as well because pleasure is so much more, and so this feeds back into spinal cord injury because what is when it's not working like before,
Mhm.
and then I actually recommend exactly what you're saying, but especially for women, I always say, well, the clitoris is only there for pleasure, so it's a part of our women
Yep.
anatomy as well as the G spot and all the other ones to actually explore pleasure pressure.
Mhm. Yeah. Well, you can have pressure in there too.
and basically it's like re-educating women to
Mhm.
actually, and often when I actually say that to women, it actually is a really shift of their perception as well. It's like, oh right, oh, and I myself had to have that shift because I think it's so we are so it's so ingrained in us, like you were saying, it's
Mhm.
only for the pleasure for the man. And what I often, see as well when I educate women about pleasure is that their partner, once they actually, incorporate that, has so much more pleasure as well.
Mhm.
And it doesn't matter, of the sexual orientation is
Right.
literally, if a woman can actually absolutely relax in her pleasure
Mhm.
and not care about, smell or, urine or bowel, like with women with a spinal cord
Mhm.
injury, the partner experiences pleasure much more as well. And that's,
Yeah.
it's like a very well kept secret, I feel.
Yeah.
Nobody talks about.
Absolutely. Absolutely. Tell me, for your ladies that have spinal cord injuries, this is interesting to me that I don't know the answer. When they experience orgasm, do they feel it like I feel it, or do they have a disconnect there? Well, how does that work for them?
So it's actually very, very individual. But
Okay.
what I can generally, what they generally give me as a feedback when they experience
Mhm.
orgasm is it's different. I would say it's not as much intense as the feedback I get. Different as well how it feels in their body. But then, it's always, orgasm is actually in the brain
Mhm.
anyways. It's basically, they say it's different but not. Yeah, it's really
Yeah.
hard to explain, and it's hard to explain for them because obviously everybody experience orgasm generally
Yeah.
differently. And so, but they say, compared to before and afterwards, it is different,
Mhm.
but not so much. It's just,
Yeah.
it's different.
That actually makes sense to me because I feel like sometimes when you orgasm, you feel more of the external part of it, which I'm sure that they don't necessarily get. But then there's that internal component
Okay.
where like your insides light up and the brain part of it and all that. So it does make sense to me that it's the same but different.
Yeah, yeah, and I think it's probably what you're describing, it's more the inside
Mhm.
part of experiencing orgasm, and then the outside part depending obviously on the level of
Yeah.
injury as
Yeah, absolutely. I'm just picturing you in your clinic trying to help these ladies figure out what positions they can be in and everything like that. Because I totally do the same thing when my patients, like, more so my guys, when they're, like, having erection issues or they have Peyronie's with the curvature or something, and we're, like, sitting in the office like, "Okay, well, maybe if you, like, did this or maybe if you did." And so I'm just totally picturing you doing that too, and I think it's fabulous. I love this.
We have actually, clients with a spinal cord injury often have like this hoists, and we often then get an OT, occupational therapist, in, and then
Yeah.
we work with the sex swing. So
Yeah.
we're looking
I love it. I love
how
it.
we can actually incorporate the sex swing in the sexual play. It's
What kind of
actually,
appointment did
it's
you
a
go
lot
today?
of
Well, I
fun.
jumped in the sex swing.
Yeah, I had one of my clients, she was like, she actually brought up that topic, and I'm like, oh my gosh, I've never thought about it. And so we literally, she's like, go in the sex swing, have some fun. I was sitting in here, like
I love it.
to our listeners and viewers, all fully dressed.
Yeah,
I think we
right?
need to mention that.
Oh, that's fantastic. Yeah, and you gotta find the lightness in all of it too, you know? You gotta be able to laugh and have the humor and while you're doing all this, because it is a
Well,
very challenging situation.
Well, and sex should be fun, right? And
It
and
should
that's
be.
why, fun and play. And this is how I approach it. When I work with my clients, I don't come in like this earnest.
Yeah,
That's work. So we actually really go and we have so much fun about it.
yeah.
And it's really, it makes such a big difference. And you mentioned I'm also a midwife, so I also work with women who have a spinal cord injury who then basically have a baby during pregnancy, birth, and postnatal. So what
Okay.
I do, I'm not their midwife, but I'm basically the missing link between working with the health professionals and my clients, basically with the specialized spinal cord injury
Okay.
knowledge, and
Yeah.
then basically support them with that as well. And it's actually very rewarding. It's a very, very rewarding job. I love it. And then
Yeah.
also, I don't know if you've heard about it for males who would like to have children. Often they need vibro stimulation, and it's called a Ferticare. It's basically something developed for ejaculation for males with a spinal cord injury. And
Okay.
so we support them as well. And I had a few babies with my male clients, and not myself, but their
Yeah, yeah,
partners.
yeah.
So
That's
we
so
looked into
exciting.
vibro stimulation.
That's really cool. Explain that more to me. Is it more of a vibration thing or what does it do?
Yeah, so it's basically a high vibrational device that is actually, supporting. There are different devices on the market. However, when it comes to ejaculation, I feel just not doing some some advertising. It's just
Yeah, go
it's the
for it.
Ferticare, which is basically, invented for this kind of support. Same again for males above the level of T6.
Mhm.
They get an AD, and so that always needs to be monitored when they use it the first time with a health professional because,
Yeah.
some can get really severe AD from it. And they always do because it's such a high level vibration,
Mm.
and then we go from there. So if it works, it doesn't work with every male, and it doesn't work below T spinal cord injury.
Okay.
So
Interesting.
it's the lower levels usually don't work. And so we also do basically fertility support and recommendations with fertility clinics, and work together with them when somebody with a spinal cord injury is actually wanting to have a child. Yeah.
That's really cool. Alternative. So that's if they're trying to have sex, ejaculate, and get their partner pregnant through the ejaculation. And then if they can't do that or they get the AD from it and so it's not a good idea, you do like semen extraction and stuff for them?
Yeah,
Okay.
Yeah, yeah, but they do have to go straight into the testicles to do that because
Yeah.
for some males with a spinal cord injury, it's actually life-threatening to have an ejaculation, which is,
Interesting.
it's a very serious topic, and
Okay.
always needs to be addressed, and always needs to addressed with a medical doctor as well,
Yeah.
because it is such a, a high level.
Yeah.
risk with that
It's so
involved as
interesting.
well.
There's so much to think about with spinal cord injury.
Mm.
Yeah. I mean, it's just so complex. I mean, just the sex just period is very complex for them to deal with, let alone everything else that they're trying to manage. It's just unbelievable to me. Wow. Yeah.
And
I'm
that's
so
why
glad
I
there's
find it
people
so
like you.
important. I was just about to say it's so important to have specialists in this field, and we are actually not many around the world. And it's really important to work with the specialists because I often see sex therapists and sexologists working with this clientele, and it's all part of the multidisciplinary team. But
Mhm.
then, when we look at the health issues that actually can come up, it's really important to have a specialist involved in this because it's like I said, with an AD, especially, it can be life threatening for a person with a spinal cord injury. And
Yeah.
so really, really be mindful when people actually recommend these, support, really to know, look, we need a specialist in there as well.
Mhm. Yeah. Tell me about your book.
Yeah, so I actually, because we all talk about the medical model,
Yes.
I was like, enough. So I actually wrote a book. I called it a playbook for sexual play after spinal cord injury, and it's called The Sensuality of Connection. So basically, I talk about the connection we have during sexual, quality of life. What is sexual quality of life? I define that as everything that surrounds sexual play. So, like you're saying, having a warm blanket or anything is what's pleasurable is
Mhm.
actually sexual as well because it's kind of related. And so it's a very, short kept playbook where I have basically different areas. I talk about how people with a spinal cord injury, it is aimed for people with a spinal cord injury, but in general, everybody can actually work with what's actually recommended in there because there is no distinction between spinal cord injury or it's just for people with a spinal cord injury. Like we said before, I need to be mindful about the health conditions they could get from actually having sexual play like that.
Yeah.
And so I'm talking about anything that's sexual play, like it's very comprehensive. I actually have it here. And I actually published it in German and in English as well.
Okay.
So just, to because my native language is German. And so
Yeah.
it's really, really cool to do that because
Yeah.
I talk about stuff like emotional intimacy
Mhm.
because that's really important as
Yeah.
well. Or, how a person with a spinal cord injury can rediscover their arousal for themselves, but also with a partner. And
Mhm.
then, communication, consent, STI prevention, everything, it's really important. And then it goes back, with the spinal cord injury. So what happens if a male, for instance, can't have actually um, good erection and then a condom doesn't work? How do they work around that? And so this
Right.
is basically all the stuff we need to look and then in the positions and what is sexuality. And then obviously with the change of sensation, can touch then be reintroduced into sexual quality of life? Often we observe people with a spinal cord injury have completely different erogenous zones as they had before the injury.
Mm.
And so how can they actually rediscover them? And so positions and then dating. So dating is a really big one. I often get with my clients, and I actually have partner. We have a program. We specifically focus on that, social rehabilitation and how people with a spinal cord injury, because it's a bigger picture, going back out, having to use a wheelchair,
Mhm.
and how can actually somebody then find the confidence again to actually go back into dating and how to actually talk about the spinal cord injury, the disability. I have some clients, they have what we call an invisible spinal cord injury, very low level, and they can still walk, and then it's basically for them really, really hard to disclose it and how to talk about it. So we actually coach them through that as well.
Mm.
And so I talk about a bit in that book as well. And then, just celebrating pleasure and really embracing it. And and not question it so much, but just do it, you know? So I
Yeah.
often say, just go for it.
Yeah.
Just do it. Just and often what I often see and often also, get the feedback is there is not much information people can know if this is actually working for them or not. So
Mm,
one of the reasons why I wanted to write that book is to actually have something together. There are fantastic books from other specialists, but what I found is actually missing. They often talk a lot about the background and the physiologically, the pathophysiological side of it, but there is not much about like tangible stuff they can do. And for me, it's like,
yeah.
okay, lay down, do this. It's basically like a bit of a cookbook
Yeah, I love that.
for pleasure.
Well, and
And
it's
then
so great because like you said, there's not enough of you as specialists to serve people. And so this is such a great way to have this book that talks about things that maybe they're not quite ready to talk about yet, or maybe they don't have a specialist in their area that's comfortable talking about that. And now they have this great resource where they can learn and explore this side of them.
And it's also, just to mention, it's also for, backed up with scientific, research and some of my own research and my team's research we have in there, where in our research, we basically look into reframing, the support, because what we identified in a systematic literature review, when health professionals talk about sex with their clients, it's always what doesn't work.
Mm,
So we actually want to reframe that and we want to say, okay, what does actually work? Because it's really important. Obviously, it's important to know what doesn't work, but we know, so we've been doing that research for 60 years now.
yeah.
So, and now it's a time to actually talk about after 60 years, now we know what doesn't work. So, what actually does work? And so, we actually also did with my team, it's just in an Australian context, but we did focus group or interviews with our participants, and it's really interesting what we also found out. And this is basically what you were saying about women. It's actually in them ingrained to talk about what doesn't work, and then you have to guide them actually what does actually work and how does it actually work, having the confidence to actually even try, because often
Mhm.
it's also what's the point and stuff like that. So I have a lot of resources in the appendix of the book, where people can actually go and go further reading where I have that all from. I talk about mindfulness techniques. I talk
Mm,
about sense eight focus and all, very much the deeper part of sexual quality of life and
yeah.
connection and pleasure. And then, people can actually go off after every chapter. I basically have the sources from
Mm,
what I'm actually talking about for people to go off and say, hey, I would like to dig deeper into this topic, like let's say sense eight focus.
yeah.
And then I basically have all the, sources in there as well.
That's
And
awesome.
I do have I worked with my students, occupational therapy students, and we actually developed a website. It's called Sex Positive Community. So it's www.sexpositivecommunity.com. And there is a lot of information as well. So for healthcare workers as well, for carers, for parents. And we also talk about, people who have a physical disability and have babies, how to navigate, accessible baby equipment and stuff like that. So
Okay.
if anybody is interested, we actually put that together, because the same problem, there's so much information, but where to find. And so what we also did is, because I often get that question, where to go and find a health professional. And
Mhm.
so but basically what we have like the hierarchy, what we from our research would recommend how to approach that for somebody who would like to talk about a specialist, and then go from there. So yeah.
Yeah, that's amazing. I love that. No, and it's so great. And I know that you work with people of other disabilities than just spinal cord injuries, but that's certainly a large part of your practice. And since we hadn't talked about that on the podcast here yet, I really wanted to focus on that today. But are there any specific disabilities or anything that you want to highlight before we wrap up?
So for me, basically, I only work with people who have a physical disability, either from birth or acquired. And there are specialists who work with people who have intellectual disability
Mm,
as well. But it's just because I'm not a psychologist, it's
mhm.
not my field I'm working in. But yeah, there, I just want to let people know there is, support out there. Be discerning, because there are a lot of people, we've just seen that throughout the world, who come out of the woodworks and now say they can do it. And especially, for people with a spinal cord injury, be really, really aware, that there are health conditions that
Mm.
need to be taken into considerations. And even if someone doesn't find a health professional, really try to find information. And even if they go to a health professional, this is something I actually talk about in my playbook as well, to really be assertive and say, even if a health professional says, well, we really don't talk about here. And then I always say, it's okay, it's okay if somebody, a health professional or anybody, doesn't feel comfortable to talk
Mhm.
to their client about it. But they should be able to say, hey, I know Stephanie and I know Marita, and I actually refer you to them.
Yeah.
This is what I would like to see, that, people are getting actually referred and recommended to the right people who can support them.
Yeah, I absolutely agree with that. I give grace to people who are not comfortable with these conversations.
Hmm.
Depending on how you were raised and all of these things, it can be very
Yeah,
difficult to have these conversations. But those of us that are comfortable, we welcome it. We love it. So send us your patients. Patients should
exactly.
seek us out. Like this is our jam. This is what we love to do. And I find so much joy in helping other people reclaim their pleasure and have amazing sex lives. So I absolutely understand what you're saying with that. I love this playbook. This is amazing. We will definitely put
Thank
a
you.
link to the playbook in the show notes, as well as your website and how to
Thank you.
get in touch with you. And I remember you were telling me before we jumped on here today, you do work with people internationally as well?
Yeah, so I basically work internationally with my colleagues, but I also offer, if somebody on my sex positive community website, I do get often inquiries as well. And then we basically look together into, when they come from another country, either I help them or somebody else looks into, what's working for them. And usually it's better for them to stay in their country, because obviously Australia has totally different legislations and insurances
Yeah.
and all of that. And so basically, we then try to connect people with somebody who's actually available in their home country as well.
Okay.
But just,
Really cool.
just to give them some support, and because it's often really hard for them, even throughout Australia, I get a lot of inquiries, Australia wide, is like, where to go? And,
Yeah.
it's really hard. And it's even hard for us specialists, we are a handful in Australia, and to actually find somebody that actually is done in this area.
Yeah.
And so yeah, it's just, I feel, and that's why I have a worldwide connection, and I truly appreciate being connected with you as
Yeah.
well, because it's really important that we stay connected as well and keep each other updated and say, hey, look, there's this new research or anything, really keep that connection between us health professionals as well. I find that
Yeah.
very important as well.
Absolutely. Bounce ideas off each other. Hey, I had this situation I haven't
Mhm.
had before. Have you had it?
Yeah,
It's so important for healthcare professionals to stay connected with other people and to be able to
yeah.
bounce ideas off each other. I think it really makes us all better providers.
Yeah, yeah,
Yeah.
I agree, and especially internationally, because you know stuff I don't know, and you see, in America I don't see, and it's really, I see it's a real eye opener to be connected to my European colleagues, to my
Yeah.
German, Austrian, and Swiss colleagues, because it's really interesting to see the differences as well.
Hmm.
And so then I come in with my Australian ideas, and they're like, "Oh my gosh!" And they come in with their German, or their
Yeah.
European ideas, and I'm like, wow, this is so cool, and we really give, support each other to
Yeah.
actually to provide a better support for our clients, and I think this is so important as well.
Yeah. I mean, at the end of the day, that's why we're all in this is to help other people
Yeah,
live their best lives and specifically for us living their best sex lives. So thank you so
yeah.
much for being on here. I just really appreciate this discussion. It was so fun to chat with you today.
Thank you. I'm so grateful that I could have that chat with you.
Yeah, absolutely. Absolutely. So, for all the listeners and viewers, we will have all of Marita's information in the show notes. So, you can find her book, her website, all of the good things. And I just really appreciate all of you listening. So, have a great week and go have some fun between the sheets. Thank for joining us and exploring sexual health topics here on Between the Sheets. New episodes are available every Wednesday. Please subscribe and rate our podcast so we can reach more listeners. And don't forget to tell your friends, partners, and anyone who will listen about Between the Sheets. Send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. It's all one word, podcastbetweenthesheets@gmail.com. Thanks for listening, and go have some fun between the sheets.